is Nicholas Phillips. I'm an orthopedic upper extremity specialist with Orthopedic Institute Brielle Orthopedics. I joined the group in September of 2022. I'm originally from Erie, Pennsylvania. I'm a DO and I went to medical school in Erie, Pennsylvania at Lake Erie College of Osteopathic Medicine. After my time in medical school, I did my orthopedic residency training in Youngstown, Ohio at Mercy Health. I was there for 5 years. After my 5 years of orthopedic training, I did a 1-year fellowship through University of Pittsburgh Medical Center in Erie, Pennsylvania. And I've been in practice for 5 years as an orthopedic upper extremity specialist. I chose to become an upper extremity specialist in orthopedic surgery based upon the experiences that I had during my orthopedic residency. During our residency, they rotate us through the various subspecialties of orthopedic surgery. Typically by the end of our 3rd year, we have to be prepared to potentially apply to fellowships and interview during our 4th year of residency for fellowships. Upper extremity was the most gratifying for me from a surgical standpoint, as well as seeing the physician to doctor interaction, as well as the patient outcomes. A lot of our livelihood depends upon having good function of our hands and our upper extremities, and the patients typically are very appreciative of the outcomes that they have from upper extremity surgeries. I think that I felt like I could make the biggest difference in orthopedic surgery by becoming an orthopedic upper extremity specialist. So my scope of practice involves upper extremity surgery, and I treat patients of all ages, starting pediatrics in the grade school level at about ages 5 and through geriatric patients, and I treat shoulder to fingertip injuries. So I do a lot of shoulder surgery, elbow surgery, forearm, wrist, and hand surgery as part of my practice. We try to treat patients as conservatively as possible for conditions that warrant that. For traumas, it's a little bit different, and there's certain indicators that allow us to make the decision as orthopedic surgeons whether to do surgery or not. But my philosophy involves educating my patients on what their treatment options are so that we can make a decision together as a team. Some of the more common surgeries that I do are shoulder replacements, fracture fixation of any fracture involving the upper extremity, carpal tunnel surgery, trigger finger release, surgery for arthritis of any joint involving the upper extremity, and tendon as well as nerve injuries of the upper extremity. My practice philosophy involves being a teammate with my patient and coming to a decision together on what's the best course of action for them. I want my patients to feel as informed as possible with making a decision on what's best for their health. I give them every option from conservative to operative, and I'm willing to be as patient as they'd like to be with going through the process of making that decision and potentially changing their plan based upon the outcome that they're having over time.